been over a month since the passage of the One Big Beautiful Bill, and if you're not familiar with it, it's a budget reconciliation package that reduces federal Medicaid spending and will leave 16 million people without health insurance by 2034. 1.9 million of those people are from Texas, and a lot of them happen to rely on healthcare for cancer treatment. Heidi talked about this bill a lot in earlier videos here on Get Real, and she warned about what the impacts would look like for people who rely on healthcare.
It hurts everybody. The elderly, it takes away life-saving access to care. Folks are going to lose their health insurance.
And now we're here 1 month later to look at a real example of what this looks like for a cancer patient in Houston, Texas. I had the fortune to speak with Rodrigo, a bar manager in Houston, whose experiences in cancer treatment can teach us a lot more about what the passage of this bill means for us. I was diagnosed in October of last year with stage 4 stomach cancer. I have been undergoing chemotherapy since November of last year. Chemotherapy is a treatment usually reserved for those with health coverage, so let's see what Rodrigo had to do to get his chemo covered. It took me almost 2 months to get my chemo approved. That is when I was already in stage 4 cancer. I was begging the supervisors, please, I'm dying inside. I need chemotherapy right now. I had to pay out of pocket anywhere from $1,600 to $2,000. From $1,600 to $2,000 every 2 weeks. On the 1st of July, I started with disability, and that's when I started with Medicaid. So I have my insurance that covers 90% of my treatment, and the rest is covered by Medicaid. Those $1,600 to $2,000 are the difference between receiving chemo or not. The difference between life and death. And it's impossible for cancer patients to receive this help with a bill that cuts Medicaid spending by $911 billion in a decade.
With the new bill, I'm up in the clouds right now. I don't know what's going to happen. I can sleep because they tell you once you're dying, that you don't have much time, and so you need to get treatment as soon as possible. I would call the same office 3 times in one day sometimes. If you wait for them to call you, the insurance can wait. Don't make you wait till you die because when you're dead, they don't have to pay for you anymore.
This bill could lead to the deaths of 51,000 Americans, and a lot of those could come from cancer patients. If you leave a cancer patient without health care, they can only hope for charity or a miracle.
I love life. I've always been a full life kind of person. So, when they tell me if you have 5% chance of surviving, I'm gonna fight the 5%, So I just love life. I love my life. So that gives me hope every day, and I thank God every day I wake up. That's all I can do.